Welcome back. Continuing the news. Chest pain can be a warning sign of a heart attack, which is why one medical expert is telling persons not to ignore the signals. Shamela Pullen tells us more in this week's health report.
In medical terms, chest pain is discomfort that you feel anywhere along the front of your body between your neck and upper abdomen. This is one of the most common medical emergencies seen at the University Hospital of the West Indies. The pain usually lasts for 30 minutes.
Patients with serious chest pain, such as a heart attack or a myocardium, usually have a severe rushing chest pain. Usually describe the pain as a 7 out of 10 on a pain. They usually is quite anxious looking, erratic, sweating up a lot, and sometimes they'll tell you that the pain moves from the heart to the wrist.
But some persons are at greater risk than others. This usually depends on the person's medical history.
Patients who have chronic non-communicable diseases, diabetes, hypertension, are at high risk, including smokers who have a family history of a heart attack. So first and foremost, the history is what is going to guide you of how things to be taken regarding chest pain. Secondly, examination, you may find a patient that is in heart failure.
Certain tests can be done to determine how serious the chest pain is. Then a determination can be made for treatment.
In the ER, for us to be more certain of the etiology, we use bedside tests such as a ECG, which electrical activity of the heart. We also use blood marker, a test called troponin, which is elevated when there's a myocardial or a heart attack, as well as other investigations.
However, it is critical for persons having chest pains to seek medical attention immediately, as this can lead to a more lethal diagnosis. With our health report, I'm Shamela Pullen, wishing you good health.